Hi, my name is Ashley. I work as a nurse and I have been in the healthcare field for over 6 years. This video is for a school assignment to bring awareness to vaccines and immunizations for children, and I thought it would be important to address some of the most common questions that parents have about immunizing their children. As follows. Number one, what do vaccines do? So, our body's immune system is made up of antibodies. I have them here as these little shields. These are representative of the body's defense system against bacteria and viruses. So, these bacteria and viruses have things called pathogens, and our body recognizes these pathogens and creates these shields or these defense system to fight off these specific pathogens. Vaccines work by training our bodies to fight against specific pathogens or antigens. They expose our body by imitating an infection, and our immune system then creates these antibodies, this defense system, so that when the real infection comes along, our body is already prepared to defend against it. Question 2: do vaccines cause the disease that they are supposed to prevent? The simple answer to that is almost never. There are two types of vaccines. One of them is called inactivated, and the other one is called a live vaccine. So an inactivated vaccine contains dead pathogens from viruses and bacteria. These dead pathogens trick the body into creating antibodies, but cannot actually cause the disease because, again, it's made from a dead pathogen. Live vaccines do contain weakened versions of the disease, which are made specifically to be weak enough that the body can easily fight it off. Very few children may react mildly to the disease. Again, they are designed to be weak enough that people don't usually ever have any kind of symptoms, and if there are symptoms, they are extremely mild. So question 3, why does my child have to be immunized if most kids already are? There's this concept known as herd immunity or community immunity that I want to represent here. So our first representation, blue people are going to represent those that are healthy but not immunized. Black people are going to represent those that are immunized, and red people are going to represent immunocompromised or those that are not able to receive vaccines. And so what happens if not very many people are immunized is when a disease comes along, that disease is able to spread fairly quickly, again, because there aren't people or not enough people that are immunized against it. And as it spreads along, it becomes kind of this outbreak. Now, this outbreak can be hindered by the few that are immunized, but the people that are most at risk are going to be those that are not able to be immunized. So, like these people in red, they're going to be the ones that get affected the most. And again, as this disease kind of continues to spread along, it becomes this outbreak, and just becomes worse and worse over time. So this next scenario that I want to show you is this herd immunity scenario. Again, the people in black are going to represent those that are immunized, and the people in red are going to represent those that are unable to be immunized or are immunocompromised. And what happens here is when a disease comes along, is because there are more people that are immunized against it, this helps the community contain the disease from ever even spreading, ever becoming a pandemic or or an outbreak. And this really affects those that aren't able to be immunized and helps protect them as well from the disease ever even reaching them. So it's important for us to vaccine as many of our kids and ourselves as possible to contribute to this herd immunity and help prevent children from contracting the disease in the first place and ever having it become an issue. Question 4, do vaccines cause autism? And though we use the umbrella term of every vaccine, the biggest worry that I think people have about having like a link between autism and vaccines actually stems from a study which was done with the MMR vaccine, which is measles, mumps, and rubella. This study was done in 1998 by Andrew Wakefield and his colleagues. This study was actually tried to link a correlation between autism and the MMR vaccine, but the study was retracted because it was deemed fraudulent and the data was misrepresented. So though the study was retracted, social media, news reports, things like that have spread that kind of information around, which has caused a fear and a mistrust in vaccines in general. There have been many studies around the world that have shown absolutely no correlation between vaccines and autism. There's a website, autism.org, which aids in information about autism, and it speaks about a recent large-scale study of over 95,000 children that shows that there is absolutely no correlation between the MMR vaccine and autism itself. Question 5, are there options if I'm unable to afford vaccines for my child? Yes, I can't express that enough. Yes, there are multiple resources to get children vaccinated at a lower free cost. One of the biggest programs is called Vaccines for Children, or VFC, which provides vaccinations for children from families that meet a low-income criteria. More information can be found at the CDC website, just search VFC. Other options include programs through Medicaid, CHIP, and other public health agencies. All of this info can also be found on the CDC website, state websites, or public local family medicine clinics. Thank you for watching my video. All of the resources that I used will be put down in the information section below this video. Thanks again.